Good evening, everyone, and thank you very much for joining us tonight. Before we get started on our webinar this evening, I would like to respectfully acknowledge, and the Alberta College of Pharmacy respectfully acknowledges, that we are gathered on Treaty 6, Treaty 7, and Treaty 8 territory, the traditional lands of First Nations people, and 6 Métis regions. The roots of many modern medications come from the Indigenous people's traditional use of plants from these lands. My name is Barry Strader. I'm the Communications Director with the Alberta College of Pharmacy, and I am joined by Pamela Timonson, who is the Competence Director here at ACP. And tonight we are here to discuss ACP's Evolved Continuing Competence Program, which of course has now launched, and pharmacists are now using this program to get their requirements finished so they can renew their registration, of course. And we're going to discuss the new CCP and the changes to the program. Pam and I will explore those changes, and then once we have our discussion, we're going to open up for questions from you and our YouTube audience. We'll encourage you to take part in the chat via YouTube and ask any questions that you might have about the Evolved CCP. And Pam and I, mostly Pam, will attempt to answer those questions. So we're really glad you took the time out of your busy schedule to join us wherever you are tonight on YouTube. So Pam, let's dive into the Evolved Continuing Competence Program, and why did ACP decide to make some changes to the CCP?
Well, what we had been doing on a yearly basis is that we had asked and provided the opportunity for regulated members to provide feedback on the program. So when they submitted their portfolio, they were invited to complete a survey. And so with 12 years of having pharmacists and pharmacy technicians complete that, we recognized that there was more fulsome changes that were needed. So annually, we had been doing little improvements to the program over the years, but then we started to recognize that there were some bigger changes that needed to be made. As well as in our previous strategic plan, we had the development of the practice improvement program, and that came about from our experiences in the competence program, where we were supporting some individuals that were having some issues completing the annual requirements, and that sometimes we found practice concerns. And so from that experience, we were wanting to develop a program that would better provide support to them. So that was one of the pieces as well. And then from the environmental scan and literature review we had completed, we recognized that there were changes across the country with different pharmacy regulators in terms of their competence programs, along with other professionals as well in the healthcare fields. And so we wanted to kind of keep up to date as well in some of those changes and be on top of things as well in that area. So that kind of lended itself to a fulsome program evaluation and then the changes that we're seeing today.
Okay, you mentioned that we surveyed regulated members about the previous CCP. What kind of feedback did you receive?
Overall, very positive, which was wonderful to see. So it definitely helped them maintain and supported them in maintaining competence, which was wonderful to see. We had lots of reports that individuals found it valuable to them in terms of having to take the time to record the CEUs and fill out records and such was valuable to a point. And it was also a sense of pride for them. So being where everybody was completing the same prescribed learning activity, there was lots of opportunity for them to have conversations with colleagues. So a lot of value was taken from the different learning activities and in recording of the CEUs. We also heard that the implementation records were a bit difficult at times to fill out. There was some repetitiveness between the learning record and the implementation records. And then, of course, we heard that for some individuals, particularly pharmacy technicians, it was difficult to find accredited learning. So that kind of all worked together as to some of the changes, or what we heard, through the evaluation.
Right. And so, of course, there are changes to the CCP, and we'll get to the changes in a minute, but there are some things that are still the same. So what has not changed about the CCP?
So what's not changed is still recording CEUs. So that was definitely something I had thought we would be changing after all these years, but no, because of the value that was still found from finding learning, completing learning, recording learning, and the reflection process that goes with that, we definitely retained that. We retained the documentation of that learning and submitting to ACP, and of course the prescribed learning as well was a component that stayed. because of the value that was bringing to the different pharmacy professionals and what they were able to take away from that learning opportunity. Also to the choice that was built into the program. We've actually created more choice in this, but that ability to choose your own learning, decide which learning you want to document and provide to the college, and then what type of learning you take still remains within the program.
Okay, so now let's talk about some of the big differences now between the previous CCP and the evolved CCP. So we'll go through a few of these here, and we'll start off with the platform that regulated members use to access the CCP and do everything they need to do, which is Academy. So let's talk a little bit about that. Academy, a learning management system. What does that mean, and what can I expect when I log into Academy?
So a learning management system allows for us to have all the learning pieces and all the documentation pieces kind of in one area. So it creates a much better user experience on the learner side of things or the regulated member side of things. So it's an area in which we can encompass many different college programs. And then we can also, for the Competence program, we have kind of everything in one area, but the usability experience in it becomes a lot easier. And then on our end, that administration of the program is also easier on our end as well. So I would say too, I would add to that with that online learning experience, it's very much asynchronous in its approach. So in terms of when you go in there, you are expected to go through and read. So all of the information is provided to you, and then you go through, you follow the instructions that are provided, and then it kind of walks you through how to complete different activities. So.
Okay, very similar to other online courses that you would have experienced elsewhere. You mentioned that it's more user-friendly than before. Can you get into that a little bit more? What makes it so user-friendly? So
previously we had to we asked regulated members to fill out learning records. And so what we did is that from that we heard through the evaluation that a lot of that was repetitive or, kind of questioned the value of. And so we took the pieces at the top and we kind of have created that into a better form for them to fill out. And then the other piece that's there is that the accredited learning information is pretty much there. The only thing that they need to do is input the accreditation number from the certificates in. Otherwise, they just are selecting the different pieces associated with it. And I guess the other thing they have to input is the CEUs that the accrediting body provides to it. So it becomes much simpler for them and more straightforward as well in that experience.
Okay, so when a pharmacist is getting ready to work on their CCP requirements and they want to go to Academy to do this, where do they find it? How do they access it?
So you go ideally through MyACP, and then from MyACP you click on the icon for the CCP and it takes you directly into Academy. And then once you're in Academy, then you're reading as you're going. So all the information is provided there for you. It's just a matter of clicking on the different buttons to kind of take you into the Competence program.
Okay. We've got some renovations going on in the building here, so if you hear that buzzing in the background, that's what you're hearing is I think they're working on the elevator. So anyways, speaking about Academy still, the layout is a bit different than what regulated members would have experienced before. So tell us a little bit about that. What's changed about the layout?
So with a learning management system, they really came about for education environments. So in that you would see an instructor that would use this to provide all the course materials for an online course or an asynchronous learning experience. And so as we're using that, that's where we then set up the Competence program in the same manner. So we have different components of the program set up in different courses. And so in that, each course kind of has different activities that you're going to complete. And so that's why when you go in there, you'll see the different tiles, and there's 7 tiles, which equate to 7 courses in that experience. And so being an education environment, we also see those terms being used, like a course, you'll see student sometimes being used in there. And so that's just remnants of that learning management system in the educational environment that it's in.
And since this is such a new experience for people, we do have some resources available for them as well to help them get through all this. Can you talk a little bit about that?
We do. So we very much appreciate, since the program is launched, we've received questions about the program. And so we've utilized those questions to help develop support materials. Also, to our experience in using the platform and then having others test it for us has really lended itself to these support materials. And so some examples that we have up in the CCP help section of Academy are a frequently asked questions document, a step-by-step guide which was provided within the pharmacist renewal email. We have support videos that really walk you through kind of step-by-step how to do that. So it's taking that step-by-step guide and making it live and someone's talking you through the process. And then we also have exemplars that are provided for each tenant to give you examples as to kind of what we may be looking for. So we quite often get the question like, so, what do you expect from me? How do I answer these questions? And so those exemplars or examples that are provided are really meant to support regulated members in knowing how to go about to answer the questions.
Okay, excellent. Let's move on to another change with the Evolve CCP, and that is no more learning records and implementation records.
Correct.
That's going to be a popular one, I think, for the pharmacists and the pharmacy technicians out there.
Yeah.
So the idea behind this evolving the shift from focusing on learning and implementing to a more holistic approach and appreciation of a pharmacy professional. So how does this accomplish this by not having the learning record and implementation record?
So with the continuous professional development approach, it really focuses on, reflecting about yourself, identifying an area you want to learn in, and then finding the learning and implementing into practice. But what we found is that in that approach, it only focuses on learning and the application of that learning. And it really doesn't take into account all the other activities or experiences a pharmacy professional has in their day-to-day work. So a lot of learning occurs in the workplace for pharmacy professionals, and yet we found that those experiences weren't always captured within that CPD or continuous professional development approach. And so we really wanted to open it up, and in order to do that, then we used the professionalism framework as our basis to do so. It allowed us to come to be able to better represent kind of that holistic or the whole of a pharmacy professional as opposed to just the piece on knowledge or learning. So it just gives us a better basis to work from, and then allows for us to have better representation across different workplace contexts and different pharmacy professionals as well, between pharmacists and pharmacy technicians.
So with no more implementation and learning records,
Those are gone.
How does the documentation of your learning change?
Good question. So in the use of the professionalism framework, we have developed different questions that still focus on those learning experiences, but really broaden them to kind of encompass a lot of the different types of work and experiences that pharmacy professionals go through. And so they're provided with different questions to think about in relation to the framework. So thinking about being a collaborator or being a leader, what does that then look like? So,
Okay.
yeah.
Another change is there's an expansion of the accredited learning. So pharmacists can now document learning that's been accredited for physicians and nurses. Pharmacy technicians can document learning that's been accredited for pharmacists. Mm-hmm. So that's a big change. Why the expansion of the accredited learning piece?
Accredited learning is extremely valuable, and we had heard through the program evaluation that there was some difficulty in finding accredited learning, particularly for pharmacy technicians. So we wanted to really open it up. Knowing how valuable accredited learning is, we wanted to make sure that there was greater access, and then also to the ability to be able to record and document that to the college was very important. So that's where that expansion came from.
Excellent. You talked earlier about the tenets of professionalism, so let's dive into that a little bit. So this, of course, comes from the professionalism framework, and let's just do a little bit of a refresher here. So we have 6 tenets of a pharmacy professional. First of all, what is a tenet, and then what is a descriptor?
So a tenet overall is a category, and then the descriptors are the way that you would characterize or describe that particular category. So if we think about a leader is the overall category, and then underneath that you have all the bullet points in the professionalism framework are the different ways to describe what it means to be a leader. So when we think about pharmacy professionals, how are they exhibiting these behaviors of leadership? What does that look like? And so those bullet points are a summary of those characteristics or descriptors of what it means for a pharmacy professional to be a leader.
Okay, and then so how are we asking pharmacy professionals to reflect on their professional practice?
So if we take a look at within the framework itself, so if we take a look at strong set of values, we're asking pharmacy professionals to think about the past year and the different experiences or learning that they've done, and then how they've experienced that or exhibited that or completed something in that realm. So if we think of strong set of values, one of the questions would be describing like, how were you compassionate, or how were you empathetic or humble in a situation? So you would go through and you would describe what that would look like. Or there are also too within strong set of values is being confident. So how were you confident in a situation? What did that look like? How did it go? And then I think more importantly is that what did you learn from that experience? So most of us, as we go through and carry out our work, we have the experience, and afterwards you're thinking, okay, so how did that go? What would I do differently? What would I change? Or it just went really well. I know to continue doing that. So there's usually kind of on the moment you're just thinking about how different things happened. So with these descriptors, we're just providing moments of pause for them to reflect upon different pieces in relation to the professionalism framework and just kind of commenting on what that looked like for them and the experiences that they had throughout the year.
Okay, so how does this approach better recognize the differences between pharmacists and pharmacy technicians? Because that's a key to the Evolve CCP.
It really, really is. So one of the things that we had heard in our program evaluation was that this program doesn't meet for me. It's really meant for direct patient care. It's not meant for, like, I'm an educator or I'm an administrator. It doesn't really fit with the work that I'm doing. And then we also heard a lot from pharmacy technicians as well, that they found a lot of difficulty in applying it to their work and the type of work that they were completing. So by using the framework as a basis for a reflection, it allows for us to be able to, the applicability across different workplaces is there. So the different contexts, and then also to the type of roles that pharmacy professionals are carrying out, they will be able to utilize different components of this framework to be able to better represent the work that they're doing. So they should have a better connection now, find pieces within this to be able to better speak to than what we had found before.
Excellent. So those are the main changes or differences that you'll see in the Evolved CCP. And of course, this has been available for pharmacists since last summer. And if you're one of the pharmacists out there who went in and took a look and did some work in there, I'm going to send you a virtual high five. Good job. Of course, there are some pharmacists who are just exploring this now, which is totally fine as well. But of those pharmacists who have already gone in there and used Academy to access the Evolve CCP, what kind of feedback have we received so far?
It looks different, and that's probably the biggest thing, because it's a new platform. So definitely when they go in, it's a different experience. And so trying to kind of figure out the navigation in Academy, right, just kind of taking a few moments to figure that out is definitely some of the feedback we've received and some of the questions in terms of the support that we've been providing. But after that, after people get used to it, they do find it quite easy, and that they're usually able to figure things out, which is wonderful to see and hear. I think from the experience of completing the different requirements, we have been hearing positive experiences and pieces from that. So that's wonderful to hear. So very excited about it.
I mean, it's always an adjustment when things are new, right? I mean, but it's like anything else. Once you get used to it, it becomes second nature, and then you forget about how it was before.
Exactly.
That's my experience anyway.
Yeah.
What have been some of the misconceptions about the Evolve program that maybe we should clarify for the folks out there?
I think implementation record, where is it? Where did it go? Do I have to provide it? That's probably one of the bigger ones that we continue to hear about. The other piece is the shock of, as they see the different descriptor questions, do I have to do this all, right? There's 36 questions, what are you doing to me? So no, you don't have to do that all, definitely not. So that would be way too much to ask of anyone. So we've heard that one. And then the way that Academy is set up is that you will see different programs in there. So right now, the SBT for pharmacists is in Academy, and the continuing competence program is in there as well for pharmacists. And so you'll see, like, for example, preceptor training is available, so that anybody that wants to become a preceptor with the new SBT, that they need to complete that program. And so there's this misconception that that the preceptor training is a part of the competence program, and that's not the case. So that's also something new too, is adapting to Academy, is understanding that the college is going to have many different programs over time appear in there. And this is kind of, right now we have two of them, but they're distinct from each other. They're not meant to all be done for the competence program.
Right.
And I think one last one that we have is the linkage of the CEUs that they document, so their learning that they complete throughout the years, or the year, sorry, that they have to kind of tie it into the descriptor questions, and that's not the case. So you can, if you want to, if you find that it works well, you're more than welcome to continue to do that. But that's not a requirement where we have to see kind of what you recorded, again, being reflected in your descriptor questions. So that's a remnant of the implementation record, and we no longer require that.
Right. So just getting out of that mindset and going to the new approach. And then, like I said before, once people get used to it, it'll become second nature.
Exactly.
Okay, well, we're going to open it up to questions now from the online audience. So we invite all of you to submit your questions via the chat on YouTube, and Pam and I will do our best to answer the questions. It'll be mostly Pam, but let's be honest, right? I'm the host. I'll be asking the questions. I'll be relaying the questions from out there. And we already have one, so why don't we just jump right in?
Oh, awesome.
So the question is it okay to complete all 15 CEs in one course or learning activity, regardless of whether it is accredited or non-accredited?
There's no rule that says you can't do that. However, we're always hoping that across the course of a year that there's many other activities that you've done as well, and that you would be excited and wanting to share those as well with the college. So technically, yes, but ideally, you're providing more than one learning opportunity and demonstrating that as well. So.
Yeah, and I think when you think of the 15 CEUs, I mean, you look at it as a chance to broaden your horizons a little bit, right?
Exactly.
And, because most courses, I would imagine, you're going to be looking at 1 to 2, 3 hours sort of thing.
Exactly.
Yeah.
Well, and if you think about a conference, and especially nowadays the way conferences are set up, not all the sessions are accredited. So you might say that, okay, so I attended 2 sessions, those were non-accredited, but here's 3 other learning activities that you're going to document separately to show the accreditation of those and those sessions. So,
right.
Yeah.
And I'll just add that if you're kind of struggling to come up with what you'd like to focus your learning on, if you missed it earlier today, we sent out our edition of Full Scale, which focuses on the Evolve CCP. And there's an article in there with some advice from some regulated members about how they approach how they choose their learning, and they look at things that maybe gaps in their own professional experience, in the way they practice, things that come up, at work on a day-to-day basis, things they're interested in, that sort of thing, and then that'll kind of inspire the learning that they want to do. So I encourage you to read that article and all the other articles on Full Scale that just came out today.
Absolutely. I think too, the pace, just to add to that, the pace of change that we have nowadays, both in across the profession, I think it just lends itself naturally to lots of different learning opportunities and different areas that pharmacy professionals can look into. And then also too, the framework itself provides a lot of different prompts as well in terms of where learning experiences may have happened that you might not have thought of that could work for non-accredited learning.
There you go.
So,
awesome. To summarize, we need to complete our CEUs, prescribe learning, and select one tenet and answer one descriptor for that tenet.
Almost. That was pretty close. So it's, you're right. Documenting learning. So you have to document a minimum of 15 CEUs of learning, complete the prescribed learning activity, and then you have to complete active learner tenet and one of those descriptors, and then choose any one of the other 5 tenets, yeah. And then pick one descriptor within that tenet that you choose.
Great. So 2 tenets total.
2 tenets total.
Okay.
And then that would equate to 2 descriptors.
And 2 descriptors. 1 descriptor for each tenet.
Thank you.
Previously, it was required to complete a minimum number of accredited CEUs alongside non-accredited CEUs. The new program does not specify if accredited CEUs. May all 15 CEUs be non-accredited?
Yes, they can. So we don't have a limitation right now in terms of how many need to be accredited or non-accredited. So we leave that to the discretion of the pharmacy professional.
Right, and in another one of the articles that I mentioned about in Full Scale, it talks a little bit about that, the accredited versus non-accredited learning, and the fact that, in some cases there might not be accredited learning that is available that suits your interest or your job role, whatever it might be. And there might be some other barriers too to accredited learning. So the non-accredited learning is a good option as well.
Absolutely.
Yeah.
Yeah.
For tenet and descriptor, how long should the answer be?
Ooh, really good question. So the exemplars that I spoke to earlier kind of provide an idea. So in there, what we ask for in the CCP manual is that you're providing a detailed response, so it's comprehensive, and that you're answering the question that is there. So to help know how much to answer, the questions are set up where there's a main question and then there's a few sub-questions underneath. Okay. And so the main question and with that is that's kind of where you would start, and the sub-questions are meant to prompt you if you're looking for other, like if I'm not sure what else I need to answer here, that's what those sub-questions are meant to do, is to prompt more reflection and description ultimately coming in your response.
Right, and then by the time you go through all that, you'll be satisfied with the answer as well, which is kind
Exactly.
of what you want, right?
Yeah.
Could you elaborate on the answer provided in the FAQ regarding how to structure responses when one is not currently actively practicing? Examples from the rest of one's life can be provided.
Okay, so I think if we take a look at, for someone, a question that we get quite commonly is someone that's on maternity leave, and they'll say to us, well, I'm not actively practicing, how can I complete my requirements if I'm not actively practicing? And I think this is another benefit of using the professionalism framework, is that when you go in and you look at the situations and the different descriptors, there's many that apply that are not involving direct patient care or that don't involve patients. So you can speak with colleagues and coworkers, different experiences you have, like I spoke about earlier, but like competence. So there's many different areas that can apply even if you're not in direct patient care or you might not be actively practicing at the moment.
Okay. We're getting a lot of requests for demos. Can you refer people to the help section in the main oh, this is probably for me. Referring people to the help section in the main purple navigation part at the top of Academy where they can find the CCP help section. So can you talk a little bit about that, Pam?
You bet. When you get into Academy, so you essentially are going to have your icons in the middle, which are your circles. Those are the different programs that you can click on. So we have the Continuing Competence Program, the Learning Activity Archives, and then we have right now the SPT program, or Preceptor Training. If you go right above that to the main bar, you'll see Help section. If you click on that, there's a little drop-down menu that comes and you click on CCP Help. And that's where we have all the resource materials. So that's where we talked about our frequently asked questions, the support videos, the step-by-step guide. Those are all there for you. And then the exemplars are found within the tenant. So when you go into the tenant and you read the instructions at the top, you will see the exemplars right there. It's a PDF that opens up.
Okay, and those resources are your friends, right? I mean,
1000%.
use them, especially if you have any doubt in what you're doing.
Exactly. Well, as I mentioned, they were really driven from the questions we were getting. And so as a team, we kind of compiled them all. We worked with the comms team and we were able to develop these resources. So they really do come from the members in terms of the experiences that they've had with the program and where they've had questions. So that's really helped us make these meaningful and relevant.
Right. That's why that feedback is so important, isn't it? It really helps us, provide a better experience for everybody. So always provide that feedback.
Exactly.
When working on one of the 5 tenants, is there a way to bookmark on which tenant or descriptor where you left off?
Unfortunately, no. We really wish that was possible, and that's something that we asked for right away, but unfortunately, the way that the system is set up, it's not possible at this time. So it is something that we've asked for an improvement or enhancement in the system, but there's nothing there as of yet. So we just would encourage pharmacy professionals just to write down or keep a track record or take a screenshot of where you are and which one you're in so that you can know where to go back to in the future. So this is, I would say, a new learning about the system that we're using in the program itself, just something we have to adjust to.
Right, and then there's always opportunities to make it better, hopefully, down the road.
Exactly. Yeah.
Are first aid and CPR recertifications still accepted as continuing education?
Yes, they are. Yeah, fantastic.
Yeah, and attending this webinar would probably be something, right?
Absolutely.
You could do that. This is learning right here.
It
so,
is.
I mean, there's all sorts of ways. Another one, we just had our ACP Connect events last week, and so if you attended those events, that could also be applied as learning as well. So there's all sorts of opportunities out there, even that ACP provides. So we're happy to contribute to that. Do we need to provide a proof for the accredited CEUs and the non-accredited ones before we submit them as we did before?
You don't have to upload evidence this time, so there's nothing that we're asking regulated members to upload, and that was a change we made in the previous program we've carried through, but we do expect for regulated members to retain those records. And so in the declaration that they're making kind of prior to submitting everything to ACP this year with the Competence program, that is one of those pieces that we put in there, that the expectation is to retain documentation related to the learning that they've done, so that if we need to come back and ask them some questions about that learning activity, that they would have the necessary documentation for that.
Right. think about it like you do your taxes every year.
Exactly.
You don't have to submit all those documents, but keep them handy because you never know, right?
Exactly.
Is it possible to log in our CE along the year as we do our readings or study, or do we need to wait until April every year?
No, this is one of my favorite features of this new program is that you can record the CEUs as soon as they happen. So it's available for you. It's a much more efficient, easier way to go about and document. So the regulated members should find it faster to complete and a little bit easier as well. And you can do it at any point in time.
Okay, well that's really awesome. And I mean, if you're doing your learning throughout the year, it just makes it so much easier come renewal time if you've already taken care of that part, right?
Correct.
And it takes a lot of the work at the end of the year off your shoulders.
Absolutely.
Which is great.
Yeah, we saw when we launched the program in July that's essentially what many pharmacists were jumping into was that learning activity course where they started to submit their CEUs or recording CEUs, and then they were completing the prescribed learning activities as well. So it was good to see.
Excellent. If you finish a course in the month of May, can we use those?
May 2026,
May,
yes.
I'm guessing May 2026.
Yeah.
Okay.
The CCP cycle for pharmacists goes from June 1st through to May 31st. So right now in this current cycle that we're in, you have until May 31st. So any learning completed in 26 up until May 31st counts in this cycle.
I think we had a question in our last webinar that was kind of the opposite question. Can we use continuing education units from years previous and apply them to this year? But that's a different answer, isn't it?
Right, that would be no in that case because it has to be within the current cycle. So we're looking at June 1st of 25 through to May 31st of this year.
Right. Let's talk a little bit about the videos you mentioned before in the help section and maybe talk a little bit about the demos that are available in those videos and how they can help people kind of navigate through the system.
So we broke out the videos into 3 different videos. So one showing how to complete the learning activity course, and then one showing how to complete active learner and the other Tenet courses. So essentially kind of walking through how to complete recording your CEUs, how to go about and launch a learning module, and then how to go about and complete the descriptor questions and what it looks like to submit or to save.
Okay, perfect. Again, I'm going to remind everybody to go ahead and submit your question in the chat on YouTube, and we'll be happy to answer them. We've gotten some great questions here tonight. I'm really enjoying the diversity of the questions, and we're getting some questions that that are thought-provoking. Let's be honest. Like they've really thought about the approach that they're going to take here. Maybe I'll ask you, Pam. So for yourself. How are you feeling about the way that the program has evolved compared to, let's say, when you first joined ACP? You and I joined ACP right around the same time, so it's been 9 years for the two of us here. It's come a long way, hasn't it, in those 9 years?
Yeah, it really has. I find it quite exciting. So I've always had a passion. Always found great interest in professional learning, reflecting back to the experiences I had as a teacher and the value that I found in learning from fellow teachers, that it was a great opportunity to look at our program and better incorporate that in just through the use of the professionalism framework. So it's been wonderful to see so much of the theory kind of come to life in the program that we've been utilizing and kind of bringing everything to life. So we had a moment over the past couple of weeks. I was guest lecturing with the Base 2 students at the Faculty of Pharmacy. And so in that, we took an opportunity to talk about different learning theories and then what we kind of did with those learning theories in our program. So it's very exciting to be able to see it all. You're like, oh yeah, look at all of these different pieces kind of coming to life. So
now it's real.
Yeah, it is very real. So it's nice to see.
A couple more questions rolling in here. What happens if our answers don't meet the expectations? Will there be some grace this year given that it's a new program?
Yeah, most definitely. We plan to take that learning approach ourselves, just trying to help people along in terms of getting to know the program. Our approach this year for this first kind of launch is let's get used to Academy, let's get used to our new requirements and kind of what we're expected to do, the behaviors that are associated with that in terms of clicking submit, where do I find different things in Academy. And then we do do plan to share the learnings and the communications around kind of what did we find and such in the review of responses to better help pharmacists next year as they go through this. So yeah, we're quite excited to see kind of what people are providing and then to be able to provide that support.
Great, well that makes sense. Can licensee education programs still be used for accredited CEUs?
Yes, it can. Yeah.
There you go. And that's one of those examples of a program where, yes, it's required if you are interested in becoming a licensee. It's something you have to have, in order to become a licensee, but also a great opportunity for pharmacists and for pharmacy technicians who maybe aren't at that point yet. I know pharmacy technicians can't be licensees, but still the opportunity to learn more about the role and how the different roles in a pharmacy work together, understand the responsibilities. Can you maybe talk about the value of taking courses like that, even though it's maybe not a requirement for you specifically?
Well, I think where we've opened up accredited learning right now for pharmacy technicians, it actually creates a really great opportunity because they can be compounding supervisors within a pharmacy. The idea is that taking the licensee program would actually be a benefit because it just provides, again, that better understanding of what's happening, operations supervisor as well. So there's more opportunities that have been created formally for leadership for pharmacy technicians. So taking this program and now being able to actually record it as accredited learning would be extremely helpful. So I think anytime we can expand learning into new areas is always wonderful.
100%. Can you please give us a written practical example for a tenant and a descriptor?
Those are, so in Academy, those are the exemplars I keep talking about. Mm-hmm. So the examples, and we have one exemplar provided for every tenant. So there's 6 PDFs that are in there to support that, including active learning. So you can see 3 different responses, full responses that were provided for the different descriptors in those areas.
And that's in the help section again?
No, those are in the tenant courses.
The tenant courses, I'm
sorry.
So
for example, I would go into the collaborator course.
Okay.
And then in the beginning are the instructions, so your introduction and your instructions. And then before you get down into the descriptor questions, there are resources there. And that's where you will see exemplars. And so if you click on that, a PDF will open up. And that's where you will see the different examples.
So this is right when you're doing your work, you can access these.
Exactly.
Perfect.
Yeah.
If an accredited CEU expires in April, can we still use it, or does the course need to remain valid until after May for it to be accepted?
So if the accreditation expires, then you'll record it as non-accredited CEU.
Gotcha.
But what I would do is that you can always reach out to the provider in case they've renewed accreditation, and then you can use that. So that does happen sometimes. Okay. But if that's not applicable to that learning activity, then it can be recorded as non-accredited.
Okay. Still learning.
Yeah, absolutely.
Yeah,
well,
right.
And if it was still accredited at the time that you took it, so even though you're recording in May, but you took it in April, and that's when the certificate is valid, you can record it as a accredited learning at that point in time.
When you record, yeah. Okay, gotcha.
It's just if it happened to expire and you took it anyways, that's when you would record as non-accredited.
Got you. Can the prescribed learning count towards the 15 CEUs?
Yes, it can. So within Academy, we have it right in the instruction section. We have the number of CEUs behind the title of the prescribed learning activity. And then at the end of the module when you complete it, we also have, and on that conclusion congratulations slide, we also have the number of CEUs that can be recorded.
And in Full Scale, we have an article as well about the prescribed learning and sort of what goes into that. It's quite a lot of work, a lot of thought goes into the prescribed learning activities each year, isn't there?
Mm-hmm. Yeah. There is. So there's a fulsome needs assessment that we do in terms of the Competence Committee, the different trends that they're seeing, the experiences that they have, the things that they're seeing in the field. And then we have input from council as well in terms of the different trends and experiences that they're seeing. Our experiences here as a college, as staff, in terms of the different questions that we see coming in and any questions around the implementation of standards, things like that, or misunderstandings in those areas. And so that's where we really gear education towards, is to support that.
Yeah, all very timely topics and things that are in front of pharmacy professionals, every day in their work, right?
Absolutely,
yeah. Is there such a thing as not passing the questions or being contacted for providing poor answers to the questions?
Yeah, for example, if you provide like a one-word response, like yes, so you're not answering the questions that are there. So the way to prevent that is just to read the questions that are there and then to respond to them appropriately is what we're looking for. So detailed, comprehensive responses that are answering the questions provided.
And it's true reflection, isn't it? It's reflection on what you've just experience,
Yeah.
what you've learned.
You're talking about yourself. You're talking about an experience you went through. So like I said, if I talked about like strong set of values where I felt confident, so I'm describing a situation in terms of where I felt confident in that situation and what I was carrying out, the activities that I was doing, that sort of thing. So I'm hoping it comes quite naturally in terms of being able to talk about an experience, and that's what we're looking for. So in that way, there's no right or wrong answers because it's based on your experience that you went through and what happened in those scenarios.
Yeah. This is a question I haven't contemplated before. I'm curious what your answer will be. Does getting your APA count towards CEUs?
You know, we have received this question before ourselves, and I think it is dependent on the type of learning that you're doing beforehand. So if you did learning, like if you went and you reviewed the standards and you talked to some pharmacists about it that had APA and you were kind of getting their experiences, then it definitely would count as non-accredited learning because you're taking that opportunity to talk with colleagues, to learn from what their experiences with were. You did some learning on your own in terms of researching, trying to figure things out. So absolutely, in that regard, it definitely will. We also see too, sometimes with new guidelines or the different patient cases coming through and learning that is associated with the patient case that they'll apply for APA, that can definitely also be provided as a CEU.
Great. Just going back to what we talked about earlier on in the evening, to confirm, pharmacists can complete CEs targeting physicians and nurses.
Correct.
So this is the accredited learning piece. Again, why did we decide to open it up specifically for those two professions, for pharmacists?
Trying to better reflect the importance of accredited learning and also to, so again, the struggle sometimes to find accredited learning in certain areas. We found and heard that it was difficult, and so we just wanted to open it up. Also, too, some of the activities that are completed across professions, are the same. And so, taking learning opportunity in documentation, you know, might be somewhat different for a nurse practitioner, but also too, there's a lot of applicability and similarity to what we're asking for pharmacists as well. So, with that respect in mind, just, you know, if I'm taking accredited learning, it'd be great to be able to count that as accredited learning for myself as well. So.
And you think about the benefits too of a pharmacist or pharmacy technician working as part of a healthcare team. You know, obviously you're working with other health professionals. It could only benefit you to be exposed to that sort of
exactly, because how fair is it that they get to claim learning, accredited learning, and then you don't, right? And so we just wanted to open that up a little bit more.
Yeah, for sure.
Yeah.
Will every pharmacist expect to receive feedback on their reflections?
Oh, that's a good question. I don't think not this year. I think we're going to come at it more just as a full like learning experience and share that through our communications team, like through the link articles and such. But it is something that we have committed to. So I know within, speaking of full-scale articles, in the one that we talked about with peer assessment and feedback, it is something that we're working towards within this area is to have more feedback provided. We heard very strongly from the focus groups that we did have some pharmacy professionals go through 12 years of the previous program and never be selected for audit or have received feedback on the portfolio that they provided or about their practice. And so we'd like to kind of do better in that regard. So providing more timely feedback, different types of feedback from their experiences in the program. So, yeah.
And sometimes when you think of the word audit, it's got kind of that negative connotation
Correct.
to it. But when you think about it, you know, it still is an opportunity to get might be positive feedback, and it might reaffirm, you know, what you're doing is the right way to do things. And so getting that positive feedback is nice to have as well.
Exactly. Yeah. I think we have the program, we've implemented the program, and now we're going to grow within that program. And so this is one of the areas that we really want to grow and expand in over the next couple of years.
Right. How will I be audited if no learning records are required? Has the audit criteria changed as a result?
That's a really good question. And yes, the audit process has changed in terms of based upon the experiences that we've had over 12 years of completing audits. We are quite confident that a strong majority of our pharmacy professionals are able to meet program standards. And so based on that, we're moving to more of an administrative review as opposed to an audit process.
Okay, so that'll be a much different approach.
Yeah.
Are there specific sites that we can visit to get accredited CEUs?
Oh, yeah, yes. So you have the Alberta Pharmacists Association, so RXA. You also have the Canadian Pharmacists Hospital Association, so CPHA, they will have it, or no, yeah, CSH, sorry, I'm getting my acronyms.
Canadian Society of Hospital Pharmacists, CSHP.
Thank you.
Yeah.
And I think they've changed to Hospital Pharmacy Professionals, I think.
Oh,
recently
okay.
With their name, I think. I could
right.
be wrong. And then CPHA, so Canadian Pharmacists Association. I'm struggling with my acronyms tonight. And then, of course, the accrediting body, CEAP, your Canadian Council on Continuing Education and Pharmacy, they have a database of learning as well that you can access for accredited learning.
Good stuff. Yeah, there are lots of sources out there for accredited and non-accredited learning. So again, if you're looking for a little inspiration, check out our full-scale issue that went out today and might give you some ideas, not necessarily about specific courses, but just on how to think about it and how to approach it. And so that would be a good way to go if you're still trying to figure out some of those last CEUs. We're getting up onto about quarter to the hour, so I'll put one more call out there for everybody in YouTube land to send in their questions on the chat. Pam, I just want to reflect on the evening tonight so far. I've just been so impressed with the questions that we're receiving from the audience tonight. This must get you really excited to see the engagement we're getting from the pharmacists out there this evening. How are you feeling, and what are you looking forward to as people start to actually put this into action over the next month and a half here?
I think I'm really curious to see what individuals are going to provide for the responses with the descriptors. So I'm really excited to see the different aspects of the work that everybody is doing and what that is looking like. The feedback too, so we have a survey at the end that we've asked for feedback on the program. So really looking forward to reading about the experiences that they had within Academy and then working towards improving. So from that feedback we're receiving, what can we do to improve the user experience? What can we do if there's any revisions that need to be made to some of the descriptor questions, that sort of thing. So, yeah.
Great. Another question just arrived. Do we need to complete the preceptor skill development, preceptor undertaking agreement, and assessment training?
So the answer is no. So that's a part of the SBT program, not a part of the Competence program. So again, the adjustment to Academy is that eventually the various college programs are going to be in Academy, like the licensee education program is another one that's in Academy. And so the preceptor training is specific to the SBT program. So if you want to become a preceptor, then you would take that program. But if you do not, then you don't have to. The Competence program is separate from that. One of the things within Academy is that they have different views or different reports that you can look at. And in those different views and reports, you'll see kind of the different courses that are available. And so that's where sometimes it gets confusing as to what you're required to do. But that's when I would encourage everybody to go back to the homepage in Academy and just click on the button for the program, and that'll take you into the area you need to be in.
Perfect. Can you still only claim up to 8 hours for a learning record? Courses like first aid are often 16-hour courses.
Correct. And so that is something that based upon, again, having a look at 12 years of data and looking at how individuals are filling out learning records and such, we're quite confident in what we've been seeing being recorded. And so with that confidence and trust, we're moving ahead now. And we took out that requirement, that limitation, so you can record, like for first aid, oh my goodness, first aid training, CBR, you can record it now just one time. So with the 16 CEUs as opposed to having to break it up. Okay,
excellent. All right, we'll put that last call still out there for the final few questions. But it's just been a great night here so far this evening to hear from you, to hear your questions. And it sounds like I'm getting the feeling in some of these questions that people are actually looking forward and excited to giving this a go and seeing what it looks like. That's my impression anyway. I don't know about you, Pam.
Yeah, from what we've been hearing too, I think Academy experience, right, just because it's new, has probably been the biggest thing. But other than that, definitely the recording of CEUs, we've heard a lot of great things about in terms of that experience. And also too, kind of moving away from implementation records, the change, right? So it's nice to have something else to think about, different ways of thinking about the program have all lent itself well. So
excellent.
Yeah.
Well, I think we're going to wrap things up. I think we've had a really great discussion tonight. Lots of great questions from the audience. And we're really glad that you took the time out of your busy schedule, your Tuesday evening to join us from wherever you are in Alberta, maybe even not in Alberta, maybe you're traveling somewhere outside of the province's borders. And so it's really nice to have had you here. Pam, thank you, and to your team for helping us out this evening as well, and providing all the information for everyone out there so they can have a successful first run at the Evolve CCP. And we wish all of you a good evening, and we'll see you soon.
Thank you.